Today, I want to talk about something that has been on my mind a lot. It's a little bit personal, it's definitely a bit professional, and it's at the very heart of why I do what I do. It's this complicated relationship between money and value and healthcare. Hi, my name is Dr. Kara Wada. I am a quadruple board certified pediatric and adult allergy, immunology, lifestyle medicine doc. I also live with Sjogren's disease and dysautonomia, chronic conditions that are driven by chronic inflammation and this dysregulated interplay between our environment, our immune system, our nervous system, all going chaotic. I've been in practice for, over 15 years, and really my practice shifted tremendously when I was diagnosed with these conditions over 6 years ago. So, as many of you may know, if you've been following me, I spent 8 years on faculty at an large academic institution. And within this last year, I left that practice and opened my own direct care practice. That means I've intentionally stepped outside of the traditional insurance-based system, and I contract directly with my patients. Now, this was a huge, very scary, and also very liberating decision. One, it allows me to provide the kind of care that is comprehensive. It is focused on that perfect storm of events that really leads to that dysregulation or all that chaos. And that is the type of care that I believe each and every one of us deserves. Care that recognizes our health as this perfect storm of factors and not just a single simple issue that requires a Band-Aid to fix it. The reality is, though, that also means my services come at a direct cost to my patients. And I want to be really transparent about this. I am constantly grappling with this. My heart to make this level of care accessible to absolutely everyone. But the reality of running a sustainable and growing practice that can truly support my patients and my family requires a different model. And it's a tension that I live with and lose sleep over every single day. What I've committed to, though, is providing immense value. My goal is that for every dollar and every minute someone invests in me, their time, their energy, their money, they get a tenfold, if not 100-fold return in clarity, in support, and with tangible improvements in their life. It's about a high-value partnership. And it's also about finding other ways to give back, which brings me to the real topic for today. Lately, I've been observing a trend in patient advocacy space, and it just doesn't sit right with me. I'm seeing more and more virtual education events, which is great, right? We're bringing education to the masses, and often they are being put on by really reputable organizations, but they come with a surprisingly high price tag for a virtual event. And I look at that and I think about the person who's newly diagnosed, who is absolutely petrified about the consequences, especially with Sjogren's. You see that risk of lymphoma and you're like, oh my gosh, I'm going to get cancer. I'm going to lose all my teeth. Like, it is incredibly scary. And you're trying to find answers that are driven with evidence in mind. I think about the family trying to manage all of the medical bills. I remember our own exorbitant copays in coinsurance, especially that first year I was diagnosed. Coincided the same month that my daughter had an anaphylactic reaction to eggs. So we had all of her bills too. And I put that into context that my husband and I were fortunate that we had a bit of savings and we had good insurance. We had good jobs. We had the ability to take FMLA if we needed it, right? Like all this privilege. And that's not the typical situation. Putting essential education behind a significant paywall feels to me like we're moving in the wrong direction. And we're forgetting the why, which is really empowering the people who need it most and who need the education. And this is where my rebellious, elder millennial, pop punk music, channeling, perimenopausal frankly pissed off, energy really kicks in. And where I've been leaning into my 4R framework of recognizing, reclaiming, rebelling, and rising. And really, it's become this call to action. I recognize there is a system that is unintentionally creating barriers to education. The reality is it costs money to put on these events, to have the staff, to put it all together, to have the platforms, to have ongoing access to these educational materials, to reimburse folks for their time and energy in providing that education. Money is the way in our society, right, that gets things accomplished. I also want to help you reclaim your right to learn about your own body and to have access to that information. And so I am leaning into that rebelliousness to create something that really reflects my values and my desire to give back on a bigger scale, especially for those who may not be able to afford to see me at the Immune Confident Institute. And that is so that together we can, as a community, rise, right? A rising tide raises all ships. And that something is the 4th annual virtual Sjogren Summit. From July 17th to the 19th, we are bringing together world-class experts, dedicated advocates, and a community of incredible patients and caregivers. And we're making the core of this event, all of the live educational sessions for the entire weekend, absolutely free for anyone to attend. For you, your spouse, your partner, your sister, your brother, your care team, invite your docs to join us. This is one of the ways that I am working on balancing the scales, my way of giving back, and it's my answer to that tension that I feel. It is a space where the price of admission is simply your curiosity. Now, as a savvy Midwest mom who understands sustainability, loves a coupon, yeah, you bet. The reality is we want to be able to do this for years to come. We want to be celebrating and having these conversations for the 20th annual virtual Sjogren Summit and have it continue on even after I, have lived my, 4,000 weeks on this planet. That is why, though, we offer an all-access pass. If you want ongoing access to the recordings, if you want all those bells and whistles and all those bonus resources, you can grab that for $47. That helps us invest and pay our team to create these resources, to pay for the platforms, to continue to host this. And really, it is an incredible value designed to be a no-brainer for those who do want to go deeper. I want to be crystal clear, though, the education itself is free. The community is free. The opportunity to learn and to connect is free. This isn't about being the cheapest. It's about being the most valuable and the most accessible. It's about creating a space where you can finally get the clarity you deserve without worrying about the cost. So if you are ready to learn, to connect, and to be a part of this incredible Sjogren's community that is flipping the script on patient education, I am personally inviting you to join us and to join the 300 plus other people who have already signed up in the first not even 12 hours that we've had it open. The link to register for free is down in the description. Click it, sign up, and I cannot wait to see you there and to see you introduce yourself and to continue this conversation and the weeks to come. Until next time, take care.